So the question is, can you develop post-traumatic arthritis after a limb lengthening? The answer is no. By definition, post-traumatic arthritis is due to a fracture in the joint that falsifies the mechanics of the joint, so in the knee or the hip. Post-traumatic arthritis can also happen if the fracture is far from a joint, but if the alignment is wrong. So if you end up severely bow-legged or knock-kneed, which we're avoiding any of that. So post-traumatic arthritis is not an issue. A lot of people have been bringing post-lengthening arthritis up, but it hasn't been our experience. We have not seen it in experience.
All right, and then the second question is, somebody asked to ask you about Nuasive precise stride mesh, please. And they're referring to, we would love to know about what do you think about all the risks they're hearing about odd bone formation, material leakage, cancer tumor, and recall?
That's a loaded question, and it's interesting because I've purposefully stayed away from that question on the forums. There's a very long thread about that because right now we don't have a lot of information. So right now what we know is that we have about 10 years of track record with the precise nail that uses the same kind of technology. It's just a different material, and we haven't seen any of those complications with the precise nail, right? It's a reliable, accurate, precise implant that achieves its goals, right? Now, the current recall is mostly, from what I understand, in Europe, in the UK, in Spain, if I'm correct, or in Ireland, and right now, the official stance of the company, and that's the stance that they give us, that they communicate to us, is that they're doing some biocompatibility testing. We personally don't have any more information than that. What we do know is that the company is meeting with the FDA because it's a very transparent company and they want to give a direction in the US and in North America. So right now that's where we're at. If you ask me, if you ask most lengthening surgeons, the implant is safe. The complications they're reporting, we haven't seen tumors, we haven't seen cancers, we haven't seen catastrophic complications related to that. So it's hard for me to statute at this point.
Okay. All right. Thank you so much.
You're very welcome.